Hey guys, it's Chris Lindley again. I'm here at Vail Health. And over the last few days, there's been a lot of questions that we've received from the community. We've also been seeing on social media. What's going on with testing? Do we have the supplies? Do we have the capability? Who should be tested? How many people have been tested? And how long does it take to get your results? So I wanted to walk through where we're at here today with Colorado Mountain Medical and Vail Health, show you the data, show you what we've done, show you the turnaround, and hopefully answer some of those questions for you. So come up closer, I want to show you first high level. So this is a report that I get every single day that we look. So far across Colorado Mountain Medical and Vail Health, this includes our entire organization, we've tested almost 1,500 people. At the end of today, it'll be well over 1,500. We still have almost 400 tests pending. This means those tests have been sent to the lab and we haven't received the results. Of the almost 1,500 we've tested, 745 have been negative, 4 have been invalid or not performed. This means maybe the media was wrong, something went wrong, we didn't get the results. But we've had 308 come back positive. So that's a rate of 29% of the total test results we've had come back positive. The other thing I wanted to show you while I'm on this graph is people keep asking, how is the hospital doing? Are you at capacity yet? And again, the answer is we are doing great. We are not at capacity. And one of the things we've been able to do is transport those patients that are in need of higher level care to Denver and the Front Range hospitals. We do this for a few reasons. First is it takes them from 8,000 feet down to 5,000 feet. So the oxygen, because of the altitude, is a big difference. The second big reason is we don't have any pulmonologists or intensivists here at Vail Health. So to ensure the best care with the folks that actually handle those type of cases, which is acute respiratory cases, Denver is a great spot to send them. So you can see, since we've started, we've sent over 23 folks down to Denver. Now I want to show you the roll-up graph that we look at. This gives you an idea of when the testing started. So you can see all the way back on March 4th, we started with our first test, and these are our results over time. The orange, as you see, are negatives. The gray is still pending, so you see the last few days we have pending results. Some of these that are farther back than 48 hours, these are tests that might have went to the state lab or to other labs. But right now, the lab that we're using, we're getting results in 48 hours. So we should have all the results from March 30th come in today, and you'll see this change. And then the positives are the blue. And what I want everybody to see is that this blue trend, as we go forward, is staying relatively constant. And so what this tells us is that we are not out of the woods yet. It is still too early to make a guess or even talk about have we got past the peak? Are we on the downward slope? Because as you can see, we're still identifying new positive COVID patients every single day in this community. And as these results come in from the past few days, you'll see these blue lines kind of trend around the same. So again, the importance of staying at home, the importance of social distancing, the importance of limiting your travel, limiting the amount of times you go to the grocery store. Maybe it's every other week, maybe it's once a week. If you don't have to get out and you don't have to interact with folks, please don't, because as you can see, we still are fighting this battle. We have a lot of great capacity at the hospital. There's great capacity out throughout the entire system with Colorado Mountain Medical. We now have 7 locations that folks can go to either get tested, to get screened, to do a wellness check, to go to our COVID respiratory clinics. So the resources are there. The planning has been great, but we want you to see that we are still in this. The battle is still being fought, and we have a ways to go. Lastly, I want to end with where you get more information. How do you know if you should be tested? So first off, what are the symptoms for COVID-19? They've now expanded beyond fever, dry cough, shortness of breath. We're now looking at headache, body ache, earache, sore throat, loss of sense of smell or taste, even abdominal pain, nausea, vomiting, or diarrhea. So here's the punchline. If you're feeling sick and if you're uncertain, call your healthcare provider. Call us and we'll be able to tell you if you should get screened, get tested. The number we want you to call if you don't have a primary care provider is 970-926 888-888-6340 or visit us online at vailhealth.org/COVID-19, and we'll be able to answer all your screening and possible testing questions you have. Have a good day.